The next aspect of James's school life we will look at is mental health. Mental or psychological illnesses and impairments can have an immense impact on a student's ability to learn and engage in the classroom. Teachers routinely report that a majority of their students have displayed or are known to have issues regarding mental health, and yet students still feel that their struggles are largely overlooked. Headspace claims that between 75 and 80% of students claim to struggle with anxiety, stress, lack of energy or motivation, and low mood. Even more concerning is the direct correlation between SES and both prevalence of mental illnesses and access to help for students with mental illnesses. There is a similar gap in teacher training which correlates with SES. ADHD has shown to lead to poor grades, poor reading and math standardized test scores, and increased grade retention. ADHD is also associated with increased use of school-based services, increased rates of detention and expulsion, and ultimately with relatively low rates of high school graduation and post-secondary education. On top of this, studies have found that even with proper diagnosis and intervention, although there is a reduction in the core symptoms of ADHD and an increased academic productivity, an improvement in standardized test scores or ultimate educational attainment is not seen. ADHD, or Attention Deficit Hyperactivity Disorder, impacts approximately 11.2% of all children and adolescents in Australia, more than 3 times more common than depressive disorder. It's particularly present amongst males, with 19.3% of males aged 6 to 12 and 10% of males aged 13 to 17 presenting with the disorder. The Department of Health released a collection of figures which display just how startlingly prevalent ADHD is amongst youth in Australia, and the many factors which can cause its exacerbation. Notably, students from lower SES families and more disjointed or mixed homes present with a much higher chance of ADHD. As we can see from the previous mention of low SES and the aforementioned statistics about ADHD, James is especially susceptible to the condition and its exacerbation. This means that James is susceptible to growing bored in the classroom and easily becoming distracted. He'll often fall off task and have disruptive outbursts. James will potentially struggle with certain social expectations, such as putting your hand up to answer a question. It's important for teachers of ADHD students to remember that their students are not acting out electively, but are suffering from a condition. Positive reinforcement and visual cues are huge guides to students like James, and better training in this department will allow students like James to see vast improvement in the class.